Your doctor might be missing a blood pressure reading that matters more than the one they always take. Not because they're careless, but because this test requires a different protocol most routine visits never include. For adults over 60, missing this reading could be the difference between catching a serious problem early and a fall, a fracture, or worse, completely out of nowhere. Studies suggest this condition affects up to 1 in 4 adults over 65, and most of them have never had this check done. I'm Dr. Mandy Thomas. Today, I'm going to explain exactly what this reading is, why it matters so much for seniors, and what to say at your next appointment to make sure it gets done. Drop a comment right now. Have you ever had your blood pressure checked in more than one position? Most people haven't. I want to see how many. If you've ever stood up and felt dizzy or lightheaded for a few seconds, that's exactly the symptom we're talking about, and it's more significant than most people realize. Let me start with a patient story. Margaret was 71. She went to her doctor every 6 months, like clockwork. Every visit, her blood pressure came back perfectly reasonable. Her doctor was happy. She was happy. Then one morning, she stood up from bed and nearly hit the floor. Vision went dark. Legs felt like they might give out. She caught herself on the nightstand. It happened again after lunch, then again getting up from her chair. When her daughter finally convinced her to mention it, her doctor did something that had never been done before. He checked her blood pressure lying down, then had her stand up and checked it again. The numbers were dramatically different. Margaret had been walking around with a condition her routine readings had never once detected, and no one had thought to look for it until her symptoms demanded it. That condition is called orthostatic hypotension. Here's what's happening inside the body. When you stand up, gravity immediately pulls blood down toward your legs. Normally, your body compensates almost instantly. Heart rate nudges up slightly, blood vessels tighten, blood keeps flowing to your brain without you noticing a thing. But as we age, those automatic adjustments slow down. The nerves signaling the heart and vessels to respond become less reactive. And medications many seniors take, blood pressure medications, diuretics, certain antidepressants, Parkinson's medications, alpha blockers for an enlarged prostate, can interfere with that adjustment further. When compensation is delayed, blood pools in the lower body, the brain gets less blood for a few seconds, and that's when dizziness, weakness, blurred vision, or fainting happens. Here's what surprises most people. Your standard sitting blood pressure reading does not show this problem. You could have significant orthostatic hypotension and leave every appointment with a clean result, because the reading was taken in the exact position where the problem doesn't appear. The reading that catches it is called a postural blood pressure check. You lie down for 5 minutes. Blood pressure is taken. You stand up. Blood pressure is taken again at 1 minute and 3 minutes of standing. If the systolic drops by 20 points or more, or the diastolic drops by 10 points or more within 3 minutes, that meets the clinical definition of orthostatic hypotension. The consequences are real. Falls are one of the most serious health risks for older adults, and orthostatic hypotension is a recognized contributing factor. When dizziness hits on standing and balance is momentarily compromised, a fall becomes much more likely. Hip fractures from falls carry serious complication rates in seniors that most families don't fully appreciate until it happens close to home. Beyond falls, research suggests repeated episodes of reduced brain blood flow may contribute to cognitive changes over time. Orthostatic hypotension has also been associated with increased cardiovascular risk, including higher rates of stroke. This is not a rare or exotic condition. It's something affecting a substantial portion of seniors right now, most of whom have never been assessed for it. Now, I want to pause here, because if this is giving you information your appointments haven't, I want you to keep getting it. Hit subscribe right now and turn on notifications. Every week I cover the health topics that actually matter for seniors, in plain language you can bring straight to your doctor. And share this today with an older adult you care about. This is the kind of information that genuinely protects people. Now let's talk about who's most at risk and what to do about it. Who is most at risk? Age itself. The older you are, the more likely some decline in these reflex mechanisms has occurred. Adults over 75 have higher rates than those in their 60s. Adults over 85 higher still. Medications are the most actionable risk factor. If you take blood pressure medications, especially alpha blockers or certain beta blockers, your compensatory response may be impaired. Diuretics reduce blood volume, making the drop more pronounced. Certain antidepressants, Parkinson's medications, and alpha blockers for prostate conditions are all strongly associated with orthostatic hypotension. If you take multiple medications, which is very common in seniors, the risks compound in ways that individual drug studies don't always capture. Dehydration. Many older adults are mildly dehydrated without realizing it. The thirst sensation diminishes with age. Lower blood volume makes the pressure drop on standing more severe and harder for the body to compensate for. Underlying conditions. Diabetes can cause nerve damage that specifically affects blood pressure regulation with posture. Parkinson's disease directly involves the nervous system pathways handling these automatic adjustments. Heart conditions and certain neurological conditions can also contribute. What do the symptoms actually look like? The classic symptom is dizziness on standing, but the picture is often more subtle. Some seniors experience weakness in the legs, as if they might give out. Others notice brief visual changes, vision going dark at the edges or things blurring for a moment. Some experience a heavy feeling at the back of the neck. Some experience a few seconds of cognitive fogginess after standing. And some have no noticeable symptoms at all despite measurable drops. Arguably the most concerning group, because there's no warning signal. Symptoms are typically worse in the morning after lying flat all night and after large meals because digestion diverts blood flow to the digestive system. Hot showers, hot weather, and getting up immediately after exercise are all higher risk moments. Understanding these patterns helps identify whether what you or someone you love is experiencing might be orthostatic hypotension. What can be done about it? Quite a lot when it's properly identified. Medication review. A physician working with a pharmacist can often identify whether any medications are contributing, and a dose adjustment, timing change, or alternative medication sometimes makes a meaningful difference without compromising the original treatment. Hydration. Adequate fluid intake throughout the day helps maintain blood volume and reduces the severity of the pressure drop on standing. Some physicians also recommend increased salt intake in specific cases, but only under medical supervision, as this is very different from standard sodium advice. Behavioral strategies. Rising slowly and in stages is one of the most effective things a senior can do. Sit on the edge of the bed for 30 to 60 seconds before standing. Pump the feet and ankles first to push blood up from the lower legs. Avoid hot showers first thing in the morning. Sit for a period after large meals rather than immediately becoming active. Compression stockings prevent blood from pooling in the lower extremities and can be genuinely effective for seniors with significant symptoms. For cases that don't respond to these measures, medications, fludrocortisone and midodrine, are available when the condition is significantly affecting quality of life. This is not something you simply have to accept as a normal part of aging. When it's identified, real management options exist. Here's what to say at your next appointment. You don't need to be a doctor to ask a good question. Something as simple as, "I've been reading about postural blood pressure checks. Given my age and these symptoms, is that something we should look at?" is completely appropriate, and any good clinician will welcome it. Come prepared. Describe your symptoms in terms of when they happen, how long they last, and how often. Mention any falls or near falls. Bring a complete list of your medications, including over-the-counter drugs and supplements. Ask specifically whether a postural blood pressure assessment is appropriate. Ask whether any of your current medications might be contributing to positional blood pressure changes. Doctors genuinely appreciate patients who arrive informed and asking specific questions. It helps them do their job better, and it puts you in a position to manage your own health proactively, on your own terms. One final note for families and caregivers. Falls happen at home. In the bathroom, first thing in the morning, getting up from the living room chair, stepping out of bed in the middle of the night. The assessment happens in the clinic, but the consequences play out in daily life. The people present in daily life are critical to both recognizing the problem and supporting the management strategies. I've put together a free senior blood pressure checklist, a one-page guide covering the postural check protocol, the medication categories most commonly associated with orthostatic hypotension, the symptom patterns to track, and the exact questions to bring to your next appointment. Many patients print it and bring it with them. It changes the conversation. Originally created for my clinic patients. The link is in the description. Grab it while it's available. If this video gave you something you needed, drop a comment below. Have you or someone you care about experienced dizziness on standing? I read everyone, and your experience might be exactly what someone else watching this needs to hear. Subscribe if you haven't. Share this with an older adult you care about, or with the family member who's with them day to day. This information protects people. Next video, the 5 most common medication side effects seniors are told to just live with, and what to ask your doctor instead. I'll see you there. This video is for educational purposes only and does not constitute medical advice. Always consult your healthcare provider before making changes to your medications or health management plan.